So today we're going to talk about infant sleep, kind of what's true, what's not true, regarding SIDS, unsafe sleep practices, but also just kind of infant sleep in general. There is a lot of information out there. I see a lot on social media about sleep when it comes to babies, and a lot of it is just untrue. So today we're going to uncover some of those myths and some of those facts regarding infant sleep, trying to debunk some of those myths and provide some truth behind some of that. I am Lauren. I am the family support specialist with Child Care Answers. So in my role, I help families through one-on-one support, parenting workshops, and helping families connect to childcare or outside resources. All of our services are free, so we are accessible to families in Central Indiana. I am also a mom of two, so I have an 8-year-old and an almost 4-year-old. And then I also have experience as an infant classroom teacher and a twos classroom teacher. So I'm able to bring kind of my expertise as a development specialist into the mix when it comes to safe sleep. I taught safe sleep training for childcare programs for 10 years, as well as classroom experience and then experience as a parent. Because when it comes to infant sleep, it's so much different when it's yours. When you're the one getting up with them in the middle of the night, you're the one caring for them every single day. It is very different than being a classroom teacher and putting some babies down for snacks during the day. So I will bring kind of both of those areas of expertise and then kind of address some of that peer pressure around sleep, some social media misconceptions, and then help kind of identify what is true and untrue when it comes to infant sleep. So Child Care Answers is very active on social media. So follow us on Facebook, Twitter, Instagram, all of those. We have our Family Fridays that get posted every Friday, which are great chunks of information for families. We also post our upcoming workshops for both families and the community. And then just a lot of really great stuff around child development, early childhood education, and all of that. We also post all of our recordings onto our YouTube channel. And then, like I mentioned, we just recently launched our new website that has a resource center that houses a lot of this information as well and builds out more resources around specific topics. We link to all of our YouTube recordings on our website in those various pages where it pertains to that information. So if you haven't visited our new website, go check it out. It's just childcareanswers.org. So this is kind of an overview of some of the topics that we're going to talk about today. So while the American Academy of Pediatrics does have their position statement on safe sleep, many parents seek advice from friends and family and social media regarding their infant sleep. And because of that, a lot of misconceptions come out around SIDS, infant sleep, what's safe, what's not safe, but also expectations around infant sleep. Additionally, SIDS research has been going on for a very long time. The American Academy of Pediatrics position statement has been out since the mid-90s, and there's still a lot of misconceptions around SIDS in general. What is SIDS? What is not SIDS? What causes SIDS? Can I prevent SIDS? All of this. And so we'll dive into that too. So we're going to talk about SIDS, newborn sleep, co-sleeping, environments, so those things that are in the sleeping environment, but also a lot of those devices are things that you might have heard of or seen. Talk about sleep routines and sleep training. I will say that if you are interested to learn more about sleep routines, I have an entire workshop on our YouTube channel about sleep routines for infants. So about infant awake windows, how to establish a routine, what a routine looks like. So if you are curious to know more about that, again, visit our YouTube channel for an hour-long workshop on that. And then also you can link to that on our website as well. So we'll go ahead and get started with our fact and fiction. For the first question or statement, SIDS can be prevented. Is that true or false? So let's see, it is actually false. So there is no known way to prevent SIDS because they don't know actually what causes SIDS. However, we can reduce a baby's risk of dying from SIDS. So SIDS is essentially when all other ways that a baby could have died during sleep has been ruled out. It's almost like a diagnosis of exclusion. That is what SIDS is when an infant dies unexpectedly during sleep. And because being a baby is a risk factor, because there are things going on internally as babies grow and develop, that just makes them a little bit more vulnerable than an older child. There has not been one specific thing that has been linked to why babies die from SIDS. So because of that, we cannot prevent SIDS. However, there are so many things that we can implement that reduces a baby's chances of dying from SIDS. And typically babies who die from SIDS have multiple risk factors at play. So you can't catch SIDS, it's not caused by infections, it's not caused by immunizations. The biggest reducer is really baby's sleep position. So in, again, the mid-1990s, the American Academy of Pediatrics released their position statement on safe sleep. It was a set of recommendations around infant sleep position and what should and should not be in the infant sleep environment. And at that time, the American Academy of Pediatrics started reviewing SIDS deaths in the United States as well as all over the world, and found that our rates were just so much higher than other developed countries. And they were trying to figure out why. Before the sleep recommendations came out, it was more like trial and error. You know, put your baby on the side, put your baby on the stomach, use a wedge, use a positioner. It was really like, let's try all of these and see what happens. Well, once they started doing research, they found that most of the developed countries in the world had been following back sleeping as their preferred method or position for infant sleep. And so at that time, the American Academy of Pediatrics switched their recommendations to strictly back sleeping, as well as like use a fan, remove blankets, don't smoke around baby, all of these things. But back sleeping being that #1 recommendation. And since that became the recommendation, our SIDS rates have dropped by half. A lot of misconceptions arise when it comes to sleep position. I've heard people say, well, it was side and then it was stomach, now it's back, when's it going to be stomach again? So I think it's important to note that these recommendations have been around since the mid-1990s. They're not changing. We're not going to just all of a sudden try putting babies on their belly to sleep. Back sleeping is working. It is reducing babies' chances of dying from SIDS by half. It is like the biggest thing that you can do to prevent your baby dying from SIDS. Additionally, I think it's important to understand what SIDS is and what SIDS is not. So I mentioned that SIDS cannot be prevented. So when we think about infants who die during sleep, we lump them into our preventable deaths and our unpreventable deaths. SIDS is not preventable. We can reduce the risk, but we can't prevent it. Where we can prevent infants dying is from things like entrapment, strangulation, asphyxia, things where either the baby's body position or an object prevents them from breathing during sleep. And these are things like using soft or loose bedding, blankets, bumper pads, pillows, stuffed animals, loveys, wubbies, all of that extra stuff, or infants sleeping in a shared sleep environment with a parent, a sibling, a twin, somewhere that was not designed for an infant to sleep. And these are our preventable deaths. So unsafe sleep practices is a preventable thing. We can put our babies safely on their back with nothing in the sleep environment. They still may die from SIDS, but their chances are very small. And we know that our baby cannot die from a preventable death like entrapment, strangulation, suffocation, asphyxia. And among those babies who died accidentally during sleep, 3/4 of those were from unsafe sleep practices, from suffocation. So it is a huge reducer, and to be able to prevent babies from dying from these known causes, or suffocation or strangulation. So knowing that suffocation is not the same as SIDS, I think is really, really important to note. So with that being said, there are tons and tons and tons of products out on the market that are aimed at helping babies sleep, reducing the risk of SIDS, getting you a restful night's sleep. So the products shared by friends and retailers through social media are all safe. Is that true or false? Yeah, I saw that false come through pretty quickly, right? Yes, that is false. All safe, false. So there is so much out there. Some are great. Some are tried and true. Others are so unbelievably safe that I cannot believe that people are advertising them or selling them. There is no one regulating the sale of infant merchandise. So I think it's important to note that. And in order for something to get then pulled off the market, the Consumer Product and Safety Commission has to say this is unsafe. So there have to be a certain amount of accidents and or deaths because of that product for it to then be pulled off the market. You might remember a few years ago when the Rock and Play was pulled off the market, and they had to change the way that they advertised the Rock and Play because it was called the Rock and Play Sleeper. It was advertised as a sleep surface. Babies were falling out of it and getting hurt or suffocating because of the fabric next to their face. And so it was pulled off the market. It was recalled. They had to change the way that they manufactured it and change the way that it was advertised. It's still sold and people still use them for sleep, but that's no longer what it is advertised as being used for. But again, a certain amount of babies had to get hurt or killed on that device in order for it to be recalled. So I did a simple Google search. I just Googled products to help babies sleep. And I was appalled by how many pictures of unsafe sleep practices I found. But these are the things that parents are flooded with when they have a new baby. And when they're asked right from the get-go, how is baby sleeping? It creates this misconception that your baby should be sleeping well. And if your baby is not sleeping through the night at 3 days old, that there's something wrong with you or something wrong with your baby. And that is just not the case. Babies aren't good sleepers. They're not supposed to be good sleepers. And so it's setting up appropriate expectations around infant sleep, is providing parents with support around sleep, but also letting them know that devices like this are not safe. The best thing for your baby is a crib or a pack and play with nothing in it other than a tight sheet and your baby on their back, maybe in a sleep sack, but that's not even necessary. And so for a lot of parents, I know I felt this even though I taught safe sleep, is that you look at this bare crib with your baby on their back with nothing, and you think, wow, this isn't cute, or I don't have enough stuff, or this just doesn't look comfortable. And baby's comfort is so different than ours. Would we be comfortable in that? No, but our needs are very different than a newborn's needs. And a newborn is adapting to the world around them, and they're getting used to what sleep looks like outside of the womb. They're waking up periodically to eat, and their needs are just different. Your baby is not cold. Your baby doesn't need a blanket to stay cozy. They don't need a pillow or any of these things. And so I get a lot of questions about mesh bumper pads because bumper pads aren't safe because of the risk of suffocation and strangulation. So I always get, well, what about mesh bumpers? They can't suffocate on those. And they can, it's not as common. It can still happen. But what happens with the mesh bumper pads is they can get caught on it. And then they can also use it as a step to climb out of the crib once they become mobile. And it's just unnecessary. It's a waste of money. Same with things like motion activated baby alarms or things like that, that if your baby stops breathing, it's going to alert you. And while those can give the parent peace of mind in order to sleep soundly, knowing that, you know, their baby is safe, which is what I find them more useful for, is for me as the parent to get sleep thinking that my baby is safe. It does not prevent SIDS. So those again, can be a waste of money. And then all of these other devices that by looking at them, they just don't look safe. For a baby who is non-mobile, they're stuck in whatever position we put them in. So if we put them next to something fluffy, they're stuck breathing into something fluffy and they can suffocate. Here are some other super common things that I see. And this is truly the power of that social media influence. These are all of the things that I see parents sharing with their friends, with their peers, of saying, use these, they really helped my baby. And at the end of the day, that they're all unsafe. None of them are designed for infant safety. They have fabric right next to baby's face. Essentially a glorified snowsuit for sleep. And one of the risk factors for SIDS is overheating. I wouldn't want to sleep in a snowsuit. I wouldn't put my baby to sleep in a snowsuit. The weight at the chest, right on their lungs that are just still developing, also doesn't sound like a great choice. So even though these products are being shared across social media and other parents swear by them, trust what you know about infant sleep and safe sleep to say, even though you recommend these, your baby might have slept well with them. I know as a mom that these are not choices that I want to make for my child and that these are not safe sleep choices. So when they're downstairs snoozing, you're folding laundry right next to them, you see their breathing, all of that. That's expensive. And so to have something for that, it just seems like a big fat waste of money, where you can prop them on a boppy pillow or lay them on a blanket on the floor. Things like that. We had a pack and play that lived downstairs that was essentially for diaper changes and then for nap time. But the floor is not a bad choice. The floor is safer than something like this and it costs nothing. And so having those is available. If you are going from the car and you get home and your baby's asleep in the car seat, it's okay to allow your baby to stay asleep in the car seat for a brief period of time. If you're, folding laundry right next to them, don't unbuckle them, keep them buckled, because that's actually keeping their airway clear. If you unbuckle them, they start to slouch and then that airway isn't clear any longer. But it's okay to do that if they fall asleep, or you want them to be close to you from nap time. There are other things to use that are a lot cheaper than this and that are safer. Again, the boppy pillow is probably a way cheaper bet, and you can use it for so many more things. And so that takes us to co-sleeping. So fact or fiction, co-sleeping cannot be done safely. Is that true or false? Yeah, it's false. So co-sleeping is often thought to be synonymous with bed sharing, but co-sleeping means so much more than that. It's kind of an umbrella term for having baby close to you while they're sleeping. It's sharing the same room or environment for sleep. So the American Academy of Pediatrics actually recommends that baby shares the same room as their parents for the first at least 6 months of life, if not a year. I know personally as a mom that I only made it 6 months with both of my kids. And the first night that they moved to their own room, I slept so well because I wasn't hearing every single sound that they made. And I'm sure that they slept better too. But it was really, really helpful in that first 6 months, which is when SIDS is at its peak. It's when they're waking up in the middle of the night to eat most frequently. It's really helpful to have them close to you, but in a separate sleep environment. So whether that is a crib, a pack and play, a co-sleeper, things like the halo swivel, something that can be next to bed or attached to the side of the bed, but not a co-sleeper inside of the bed with you. So that baby is still close to you. So that is the safest way to co-sleep. Babies who are at highest risk for co-sleeping injuries are formula-fed babies, not breastfed babies. So babies who are brought to bed to nurse and then put back into their own sleep environment is totally safe. It's actually safer than getting up and falling asleep in a chair while nursing. But co-sleeping can be done safely. And in fact, room sharing lowers the risk of SIDS by about 50%. as well as bed sharing increases the chances of baby dying from preventable death, not from SIDS, but things like suffocation and strangulation. They found that in 2014, they looked at all of the babies who died that year from unsafe sleep-related deaths and found that 69% of those babies were sharing a bed with somebody at the time of death. So these are not the SIDS deaths, but those that were preventable. 69% were sharing a bed with somebody when they passed. So as we're thinking about back sleeping and SIDS and all of this, my next question is, babies who sleep on their backs choke if they spit up or vomit during sleep, which is the question I used to get asked all the time when I was teaching safe sleep class. Yep, and that is false. SIDS is not caused by vomiting or choking, and actually sleeping on their back is the safest position for a spitter to be in. I always then get, well, I've always been told that if my friend is drunk and they pass out, that I need to roll them over to their side so they don't choke on their vomit. I used to get asked that every single time I had safe sleep training. And a baby is not a drunk adult. Two very different situations, two very different abilities of arousal, two very different diets. Their needs are just different. So comparing them and thinking that they need the same thing is just false. So here is what happens internally when a baby spits up. So when a baby's on their back, you have their esophagus and their trachea. So the esophagus is the food tube and the trachea is the windpipe. The esophagus is underneath the trachea. So as the spit up comes up, it comes up into the mouth and either spills out the side of their mouth or gets re-swallowed. And as you can see in this picture, there's nowhere for that spit up to get stuck. It slides right back into the stomach due to gravity. You may hear your baby cough a little bit, and you can't cough and choke at the same time. So if you hear your baby coughing, that's actually a really good thing. It means that they're naturally clearing their airway, and that's what you want to hear. When you flip your baby now on their side or stomach, you have the trachea below the esophagus. So their windpipe is under their feeding tube. So what's happening is when they spit up, it either gets pushed out of their mouth and now they're laying in it, or it gets re-swallowed and gravity is wanting to pull it into the lungs. Also, when it's coming up, it has a higher chance of going out both the nose and mouth and clogging that airway. So it is much safer for a baby to spit up laying on their back than laying on their side or stomach. My son was a high spitter, did not gain weight because he spit up so much. And he was always a back sleeper from birth. I'm so glad that I taught this class before I had him, because I may have tried different positions. I may have tried putting him at an incline or sticking him in the bouncy seat or something that I've heard, have you tried this? Have you tried that? But truly sleeping on his back helped him, and he never got anywhere close to choking. So I can definitely attest to it is safe. That is definitely a misconception, but seeing those tubes and the way that they lie, I think really helps kind of work through that misconception. So we're going to shift outside of SIDS and infant to look at just infant sleep in general. So true or false, don't rush to soothe a crying baby. Hashtag truth. Yes, that is mostly true. So we want to give babies the opportunity to work things out themselves, to learn how to self-soothe, and to learn to wait. That doesn't mean that if your baby is screaming their head off that you're like, it's fine, you'll be fine, you can just hang out over there. We want to be responsive to our babies, but that doesn't always mean rushing and picking them up to soothe them. So babies older than 6 months have the ability to begin to self-soothe. So at night, if your baby who's older than 6 months starts to stir, starts to whine, starts to fuss, give them time to work it out, because they may not need you to rush in and pick them up. And this is what was really helpful for me when my kids moved out of my room and moved to their room, is that I wasn't rushing at every sound. I gave them the opportunity to kind of work things out, to fuss it out, to complain a little bit. You know your baby's cries and you know if they need something or not. So waking at night and crying a little bit does not always mean that they need something. Additionally, during the day, your baby might be playing on the floor and start fussing and whining because they're bored or they need a different position. They want you closer to them, and you don't have to go rush over and pick them up. But you can respond to them and say, I hear you. I know that you don't want to be doing tummy time anymore. You're getting tired of it. I'm almost finished folding the laundry, and then when I'm done, I'll pick you up. So every time we respond in that way and then follow through, we're teaching our baby that we're somebody that you can rely on, you can trust me, I'm here to meet your needs, but that doesn't mean that I have to like rush up, pick you up and calm you in that manner. It's also okay that if you are frustrated with your baby's crying, to put them in a safe place and to walk away. I found it helpful as a mom when I just needed a break and I couldn't deal with the crying any longer, to go take a really quick shower. In the shower, I couldn't hear my baby screaming. It gave me the opportunity to calm down, because if I could hear him or her crying in the other room, I wasn't calming down. And then I would go back and I was just a different mom when I re-entered parenting at that moment. So it's okay to put your baby in a safe place and walk away and let them cry a little bit. They'll be fine, you'll be fine, and it'll help you both get a break so that you can be a better parent as you come back. So the next question, sleep training is synonymous with the cry it out method. Is that true or false? Yeah, that is false. So sleep training, again, is kind of an umbrella term. It is basically a spectrum of approaches to help baby learn how to fall asleep on their own. Anywhere from super gentle methods of laying down next to your baby's bed until they fall asleep and then you leave, to the Ferber method of cry it out, and anywhere in between. There are so many different approaches. And so when someone suggests, have you sleep trained your child? We automatically jump to cry it out. And for some people, that is what sleep training means. But for others, that's not what they may be referring to. So I think it's important to always ask for more information. When you're talking about sleep training, what does that mean? What should I be doing? What is my role in that? And what is my baby's role? Some go for the full Ferber method. Others prefer to nurse their baby to sleep, lay them down, let them, cry or fuss a little bit, and then go back and pick them up. Others put their hand on until they're fast asleep. Whatever your method is, there is no right or wrong approach to sleep training, whether you go on one extreme or the other. So I think that that's important to note. So with that being said, a good sleeper is a baby who doesn't wake at night. Is that true or false? Exactly. So a lot of families choose to sleep train, or they seek sleep training information because they're frustrated that their baby's waking at night. And the reality is babies wake up at night. They wake up because they're hungry. They wake up because they have gone through a full sleep cycle and they don't know how to put themselves back to sleep in light sleep. They just know how to do it in deep sleep. They're practicing skills in the middle of the night, like rolling over and talking. There's a lot of brain development happening in the middle of the night. Babies sleep. They're not good, they're not bad, just babies sleep. And sometimes they wake up. We wake up at night, but we have the skills and ability to put ourselves back to sleep. So by talking a lot about sleep training, while also making the assumption that your baby should be sleeping through the night by now, we're again giving families information that makes them think that their baby is a good or a bad sleeper. And that's just not the case. I've never met a bad baby. Even a baby who cries all day long and doesn't sleep at night is a baby. They're not a bad baby. I think that babies are the most innocent thing on earth, but that's a whole other conversation. So some babies will need to eat in the middle of the night, all the way up until their first birthday. So as their body is growing, especially breastfed babies, they do need to eat in the middle of the night. And so a baby who's waking, finishes a bottle or eats well at the breast and then goes right back to sleep was hungry, regardless of how old that baby is. If they're nursing just a couple of suckles and falling back asleep, or they're not finishing a bottle, then they weren't hungry. And so knowing your baby and knowing what they need in the middle of the night is important. If your baby is waking and eating, they're hungry. If they are just suckling and going right back to sleep, then it may be waiting until you go in and respond, or nursing and putting them back to sleep and allowing that to happen. And you say that's totally fine. It could be going over and rubbing your baby's belly until they start to doze back off. It may be introducing a pacifier, whatever the approach is that you take. But it is okay that your baby is waking in the middle of the night. Additionally, if you're nursing at night, let go of the guilt. I'm sure that you have had at least one person insinuate or tell you that you should stop nursing in the middle of the night, and you do you. Nursing at night is normal. Most breastfed babies wake 1 to 3 times at night in the first year, and that is okay. Yeah, they might develop a sleep association with nursing and that they can only fall asleep at the breast. And that is only true for light sleep. That doesn't mean that in the middle of the night during deep sleep that they can't fall back asleep. They may have that association with light sleep or falling to sleep. And that's something that can change as they develop new sleep associations, and that's totally fine. And also, sleep normalizes. So by age 3 to 6, sleep is normalized. So regardless of whether you were Ferberized, you were nursed to sleep, you were placed to sleep drowsing, you fell asleep on your own, in this perfect scenario, sleep normalizes between the ages of 3 and 6, and most children sleep just fine between that point. So again, let go of the guilt. They're only small for a short period of time. So if you're enjoying nursing your baby to sleep, your baby is enjoying nursing to sleep, and you're cool with that, keep rocking it. The next question is adding rice cereal to baby's bottle will help them sleep through the night. I see this thrown out as a suggestion all the time, that either introducing solids early or adding something to the bottle will help them sleep longer. And exactly, that is not true. It is an old wives' tale. It is something that has been debunked many, many times. Plain and simple, food should not be introduced to babies until they're around 6 months old. We still want them getting the majority of their nutrition from breast milk or formula in that first year of life. And adding anything to a bottle poses a choking hazard. And it also can make their belly a little upset. And if a baby needs to eat, they're going to eat regardless of how much they eat at last feeding. If they eat every 4 hours, regardless of how much they ate, they're going to eat every 4 hours. And by bulking up the bottle, it can also lead to an increase of spit up too. So it's just not true. Your baby's still going to need to eat. And then you're going to be frustrated and wondering why they're not sleeping longer after you've added the rice cereal to their bottles. True or false? Once a bad sleeper, always a bad sleeper. And I think that I've already probably answered this a little bit for you. But yeah, that is not true. So you can breathe a sigh of relief. So even if your baby was super colicky and up every hour for the first 6 months, that doesn't mean that at 14 months, 18 months, 3 years, that they're not going to be a good sleeper. Again, sleep normalizes between the ages of 3 and 6. And with a solid sleep routine, any baby, any child can get used to what sleep looks like and develop sleep habits. So as we talk about sleep habits, bath time is essential for snooze time. Is that true or false? And that is true-ish. Yeah. So it's not required, but it certainly can help. So it's a fact-ish. And so while it does not necessarily mean you have to give your baby or child a bath every night, a consistent soothing routine does encourage healthy sleep habits. So if we have a baby or a child who is waking every hour, creating a consistent bedtime can help alleviate some of those and can help create healthy sleep habits and positive sleep associations. A bath is kind of your number one thing to help soothe baby before sleep. I know even for my son at 8, the nights that he showers before bed, he transitions to sleep so much smoother than the nights that he doesn't. It really, really helps him kind of calm and get ready for sleep. So I have heard parents say like, oh, I can't give my baby a bath every day. I only bathe them like once a week or every other week because their skin gets so dry. And babies are sensitive. So if we're using something sensitive, they should be fine with a bath every day if that's what you choose, but you don't have to use soap or any cleaner in the bath. It can just be water. From the time my baby's umbilical cords fell off, we started doing a bath every single night. And my 4-year-old still takes a bath or a shower every night. My 8-year-old now weasels his way out of them because it just, dampens his evening routine of playing and doing all of the other things that he would rather be doing than cleaning himself, when he's probably the one who needs one every single night. But it has always been part of their sleep routine. And because of that, I believe that my kids have had really positive sleep associations, even with me nursing them to sleep every night, that they did very well when it came to having a consistent routine and understanding the difference between a nap and nighttime sleep and transitioning to bedtime a lot smoother. It helped them learn the difference between their days and their nights as a newborn, and really helped create positive routines around bedtime in a time that can be stressful in some households. So while this is a fact-ish, it is essential to have some sort of bedtime routine, whether that involves a bath, a massage, books, something soothing before you lay your baby down to sleep. So I have gone over SIDS and infant sleep and sleep associations and co-sleeping and devices and all of this, kind of ending with sleep routines. So I just wanted to kind of open it up for any questions about any topics that we haven't talked about. These are some of the conversations that I had as the parent, but also have had with other parents, especially around sleep and childcare versus home, because the settings are two very different settings as well. So when it comes to creating routines, what's important is that nighttime routine stays as consistent as possible. Nap time routine can be much more flexible, and that doesn't mean that you can't be out and about and your baby falls asleep in the stroller or falls asleep at a friend's house or falls asleep on you while you're out to dinner or things like that. Babies are super adaptable, and they learn that expectations differ between settings. So they learn very quickly that my nap in childcare looks different than my nap at home, or I'm out at dinner, so I'm going to fall asleep on mom or dad versus being at home with my sound machine and my lavender oil that I got rubbed in and my bath and my book and all of that. So they are very adaptable to the different settings. Babies who are never out and about don't adapt as well. So we want them to be out. We want you to go about your typical routine while also prioritizing nighttime sleep. So with naps, I like having a light on or noise around, continuing to do what you normally do during nap time. So having your baby downstairs while you're doing other stuff is great because they learn to sleep through noise. At nighttime, having the blackout curtains and the sound machine and the swaddle and the passy and the bath is also really helpful to establish the difference between night and day and develop a solid bedtime routine, because their sleep cycles look different for a nap in bed. And so we want them to understand the difference between the two. Having them be flexible allows them to learn how to sleep in different settings like childcare or out at the mall or at a friend's house, while still creating a routine, if that makes sense. So kind of a happy medium between the two. I think you'll find our website helpful. We have a page on breastfeeding. We have a page on sleep, which has infant sleep cycles on there, which I think you'll find really helpful. And it shows like how often babies should be napping based on their age, and how long they've been awake. So feel free to shoot me an email with any questions that you have. Watch our recordings. Bye.